And where did that fat and cholesterol come from? The patient says, 100% of the time, I ate it. When the patient's in the coronary care unit, I'm usually seeing them, because I'm not doing invasive cardiology, I'm seeing them on rounds the next morning. Okay, so I said, I'm going to ask you to do a little quiz with me. Tell me what happened to you while you're here. And they say, I had a heart attack. That's right. How did the heart attack happen? Well, they told me I had a blocked artery. That's right. Okay. What was it blocked with? Plaque? That's right. What is plaque made out of? Fat and cholesterol? That's exactly right. And where did that fat and cholesterol come from? The patient says, 100% of the time, I ate it. So Rush University is known for having a large number of plant-based, vegetarian and vegan cardiologists. One of the top, healthcare economists in the country told me personally that prevention always is going to lose money. Well, it turns out not if you live in a saturated area. You move those patients out and you have new patient access. And it turns out that, revenue in cardiology is driven by new patients. We are in an area that is saturated with cardiovascular disease. A lot of Hispanic patients, a lot of African American patients, but really all varieties. And the burden of cardiovascular disease is so great in this area, as it is around the country, 100 years in a row that cardiovascular disease is the leading killer of Americans. We had people developing bypass surgery, heart transplants, putting in defibrillators, coming up with statins, all had the hypertension program that really changed the paradigm for how we treat blood pressure. All of these things, all these dedicated physicians, they're all going to have all of this career that they dedicated lose to a double cheeseburger? Really? That's really what's going on. I always used to say that, the coronary heart disease is culinary heart disease, mispronouncing it on purpose, okay? So if we really want to change the paradigm and get heart disease to be number 2, which I was always saying, I want to be number 2 before I end my career. If we're really going to do that, we have to start with the worst community, and that is the African American community. We have about a 21% higher cardiovascular mortality rate in the black community of this country. And it really does have to do with the diet, the Southern diet. And what they really mean by that is soul food. More cholesterol, more saturated fat, not just chicken, but fried chicken. That's a combination that is set up for heart disease, kidney disease, stroke, and death. At Rush, we're doing interventions, not just screening at churches, and we got almost 50 people to change their diet for Lent. And for 5 weeks, they went completely vegan. The risk had dropped 19%. That's almost the entire difference between the black population and the rest of the country. Almost could be obliterated just by diet. It has to do with lifestyle. The chair is the new cigarette. People need an early release program from their sofas, and we need to stop eating animal products with high saturated fat, high sugar, refined carbohydrates. If we do all that, which would be a whole food plant-based diet, we can defeat this problem. I'm telling everybody, it's their patriotic duty to become a vegan, do a whole food plant-based diet, and tell everybody about it.